Okay, before I start, I would like to thank you so much for coming all this way for this presentation in your precious Sunday morning. And I really appreciate Megagen for inviting me to share my case in the Continental round. Let's start off with a simple question. Can a new smile make you look more intelligent and successful? A 2007 published article answers yes, it does. The data from the study demonstrates that a smile has great impact on perceptions of one's attractiveness and personality. So let's warm up with a simple yet critical case that demonstrates the importance of an anterior prosthesis. A 42-year-old lady visited our department before an endodontic treatment. In the space where there should have been a 4-unit bridge, there was a 3-unit bridge instead. So we decided to remake the anterior prosthesis. Through provisional restorations, we tried to change many aspects. The most critical part was to place 4 teeth in a limited space. We arranged the teeth to overlap each other. The right lateral incisor was designed symmetrical to the left lateral incisor, and the right canine has a short mesiodistal width, but it was designed to appear natural on the frontal view. The prosthesis was cemented. And this is the intraoral photo comparing before and after the treatment, her smile line following the lower lip line, and the facial appearance. We can now look at her smile, and we can know that her smile really changed through our work. So this is why we put efforts when designing a patient's smile. Smile designing has progressively evolved, and it can now be done through various digital methods. Case 1 is a case with a full mouth rehabilitation and with a demanding patient. The diagnostic phase. She was a 75-year-old lady who wore dentures on both jaws, but it wasn't really working quite well. It was an ill-fitting denture. The periapical view shows the remaining teeth with questionable prognosis. And the intraoral view shows that she has lost her original vertical stop. Diagnostic mounting was done, and we decided to rehabilitate our patient with fixed prosthesis because removable dentures have been reported with multiple complications. The treatment plan was set to rehabilitate with fixed prosthesis, including multiple implants. The digital implant planning stage. Radiographic stents and surgical guides were fabricated. 6 implants on maxilla and 5 implants on mandible were planned. Surgery was done on the maxilla first. However, unfortunately, 1 implant failed, and we decided to place another implant on the left canine. And we'll move on to the restorative phase at this moment, and the main point here is that I really tried to meet the patient's needs. This phrase here is what I actually heard from my patient. So I thought that this case was not going to go very easy. So we're now at this point, and first, both upper and lower temporary denture was fabricated. The patient thought that her lips were sticking out with the denture on and wanted the incisors to be in edge-to-edge by position. So we designed a new fixed provisional prosthesis to meet her needs. We can see the facial appearance and tooth arrangement changing with different prostheses in her mouth. The first provisional prosthesis got fractured, and we made a second provisional. The patient disliked the buccal face of the anterior incisors heading upwards, so we modified the incisal angle. The implants were now placed on the mandible, and we were now ready to start full mouth provisionalization. The patient had 3 main requests, so we told her we will try our best to meet her needs through facial scanning and show her the results afterwards. The patient wanted the lower lip to protrude more than the upper lip, and she wanted the anterior teeth to be in a more lingual direction. Also, she wanted to keep the teeth length similar to the current state. The intraoral scanning was done with and without provisional prosthesis. The anatomic features were also marked on the study cast to help our dental technician do her job. Facial scanning was done using a stationary dental facial scanner, RayFace, and an extraoral transfer jig was used. The facial scan data and full mouth provisional prosthesis design were superimposed. We checked that the new design meets the patient's needs. The preparation and provisionalization was done. And this is the intraoral photo after the professionalization. And facial scanning was done after the treatment to confirm and check the changes in her facial appearance in 3 dimensions. We can see that her upper lip has retruded and she was satisfied with the result. This is a photo of her smile. And we can see the improvements made, although she was quite camera shy after the treatment. Please excuse me for a moment. And case number 2 is also a full mouth rehabilitation, and I titled this Back to 1992, and I'll explain why the title shows as this. This is another 75-year-old lady with severe attrition and multiple retained roots. The retained roots were first extracted. This is the intraoral photo with the patient at the beginning. And in order to rehabilitate her mouth and create a new smile, I asked her to bring her photographs before losing her teeth. She answered yes. And she also told me that she lost her reasons to smile as she lost her teeth. So it was very heartbreaking for me. She brought me about 50 pictures from her house, and I found a nice picture of her in the year 1992. The treatment plan was set to rehabilitate with fixed prosthesis, including all-on-4 restoration on her lower jaw. All-on-4 prosthesis was planned because of the following reasons. First, a single lower complete denture opposing a natural dentition has a poor prognosis. And second, there were enough bone in the anterior area because of the retained roots, while the bone quality was very poor on her posterior area. The temporary denture was fabricated first for her to use and recover her occlusal vertical dimension. Now we're planning the implants. And this is a video recording mandibular flexure with a dental plaster vertification device. And because of the risk of the mandibular flexure, the 4 implants were planned to be placed in the anterior areas. The surgery was done along with bone flattening and bone grafts. The panoramic view after surgery. Moving on to the restorative phase, our goal was to recreate her smile in the year 1992. And between the 2 methods, we decided to go digital in this case. First, multi-unit abutment was selected, and all the margins were to be supragingival, and 2 30-degree angled abutments were used for the canine implants. The scan bodies were connected, and her temporary denture was copied and printed and modified to help the bite registration process. The intraoral scan data were obtained. Facial scanning was done using a different stationary facial scanner, Bellus. And in this case, also the extraoral transfer jig was used. This is the scanning process recorded. She sits down in front of the scanner, and it just takes 3 seconds for the scanning process. So we now have three facial scan files, with first the rest position and a smile position, and the last one with a transfer jig. And we have the facial scan files, and we superimpose the 3 facial scan files with the help of the extraoral transfer jig. The transfer jig itself was also scanned using a model scanner. So this is the whole process recorded thanks to my fellow technician, and these are the various information for smile design that we obtained through her original smile she had 30 years ago. And a new facially driven smile design was created. Prostheses were fabricated, and jigs to aid prosthesis setting was also made. It was designed to use in order to help place the prosthesis in the designed position. Preparation and provisionalization was done, and the positioning jig was used while relining the provisional shells. All the natural dentitions were prepared, and all-on-4 prosthesis was placed on the mandible. This is the intraoral photo after the treatment, and the photo shows a nice smile of our patient. And moving on to my third case, up to this point, we have discussed smile design mostly done on the lab side. Now, I would like to talk about smile design that can be done on chair side using a smart device. So let's start with the diagnostic phase. It's a 50-year-old man who walked into our department to restore his missing teeth. This is the initial photograph. And the patient's smile index was 9.55, which was higher than the aesthetic value due to the reduced interlabial gap resulting from reduced occlusal vertical dimension. The treatment plan was set to do a full fixed restoration. All the implants were neatly placed at an adequate position and natural dentitions were prepared. Moving on to the restorative phase, we're going to design our patient smile using a smart device. Following jaw relation record, full arch provisionalization was done. And smart devices was used at this point at the chair side. iPhone 14 Pro, iPad Pro 5, and a software named SmileFi was used in this case. The patient's facial and dental features were analyzed. The current provisional restorations seemed to be in harmony. The patient's facial flow was also analyzed and determined that a slight midline shift to the patient's right side can be acceptable. The patient's facial shape and impression was also checked in order to achieve overall harmony. The patient's lip was checked, and the upper lip was slightly longer than the optimal range. Dental aesthetics were analyzed, and it was planned to show more of the maxillary portion in its definitive prosthesis. The smile arc was between the positive and straight range, so it was planned to make it look more positive in its definitive restorations. The patient's new smile was designed chairside using smart devices, and this is the result. Since the existing provisional restorations seemed crowded and appeared feminine, I focused to appear it more masculine. Also, I designed so that more maxillary portion could show when the patient smiled spontaneously. The design smile data was used to communicate with the technician and request modifications. The changes appear on the design files and on the actual prosthesis fabricated. Adaptation of the zirconia prosthesis were checked. Staining, texturizing, glazing, and polishing were done afterwards. Definitive zirconia prostheses were cemented. On the left, we see the initial photographs of the patient, and on the right, we have our final results. The smile index value has recovered to the aesthetic range. The incisal edge display has been improved when compared to its provisional prosthesis. The anterior occlusal plane and lip line was also set in harmony with the curvature of the lower lip and achieving a positive smile arc. Here we see the patient's facial appearance. Now the patient can smile brighter, eat what he wants to, and live a much more confident life. Well, this brings me to the end of my presentation. Let me just look at the key points once again. Digital smile design has many advantages, including facially driven prosthesis, and it can reflect patients' preference to prosthesis and capture the patient's attention. And last but not least, it can improve communication between patient, dental technician, and clinician. Thank you so much for your time, and I'll be happy to answer questions later on. Thank you so much.